We're all here for you, but we need you all to be here for us.
We're tired. We're exhausted.
We're all taking care of more patients than we ever have.
I would never, in my wildest dream, would have imagined that we would be here again.
It's the great resignation hitting the healthcare industry at the worst possible time.
America's healthcare system is on the brink of collapse. Doctors are vanishing from hospitals, nurses are burning out, and patients are left waiting, sometimes for months, to see a physician. But what's really behind this healthcare crisis? And what does it mean for you? Today, we're diving deep into the alarming trend of mass layoffs in healthcare, the exodus of workers post-pandemic, and why finding a doctor might soon be a luxury. In 2023 and 2024, hospitals across the United States began laying off thousands of healthcare workers. Kaiser Permanente, Ascension, and even urgent care chains like Optum announced mass layoffs that shocked the industry. But why is this happening? For one, hospitals are bleeding money. Rising operational costs, decreased reimbursement rates, and an over-reliance on temporary staff during the pandemic created a financial black hole. In 2022 alone, US hospitals reported a combined net loss of over $50 billion. What happens to patients when the staff is gone? If layoffs weren't bad enough, healthcare workers themselves have been fleeing the industry. During the COVID-19 pandemic, over 500,000 nurses left the field, and the trend hasn't slowed down. Burnout, trauma, and a feeling of being undervalued have driven tens of thousands to quit. Imagine working 12-hour shifts in a COVID ICU, only to watch patients die because there weren't enough ventilators or enough staff. In a 2023 survey, 42% of healthcare workers reported considering leaving the field altogether. And here's the kicker. Many of these workers didn't just leave their jobs. They left healthcare entirely. They're now working as tech analysts, real estate agents, or in other less stressful and better paying fields. Once they're gone, they're not coming back. The US healthcare system was already short 20,000 primary care physicians in 2020, and this number is expected to rise over 120,000 by 2034. Residency programs aren't expanding fast enough, and older doctors are retiring early to escape the chaos. In rural America, some patients drive over 100 miles just to see a doctor. But this shortage isn't just a rural problem anymore. Urban areas like New York and Los Angeles are feeling it too. Major cities are running out of specialists, neurologists, cardiologists, even OB-GYNs, and the ones who remain are overwhelmed. But why isn't anyone fixing this? So why isn't the healthcare system solving this crisis? Two words: profit margins. Corporate healthcare giants prioritize efficiency and revenue, often at the expense of patient care. In 2023, CEO compensation in some hospital systems climbed as high as $30 million annually, while layoffs decimated staff. And let's not forget the insurance companies. They dictate which treatments get approved and how much providers are reimbursed, adding another layer of stress. Many doctors I know are saying, why am I doing this? For patients, this crisis means longer wait times, less access to specialists, and rushed appointments with burned out providers. The average wait time to see a primary care physician is now 26 days, and that's in cities. In rural areas, it's closer to 3 months. It's no longer just about finding the best doctor. It's about finding any doctor. So, is there hope? Well, the answer is yes, but it won't come from the current system. Solutions like telemedicine and concierge practices are emerging as viable alternatives. These models bypass traditional insurance and give patients direct access to doctors. Change is possible, but it will require patients and providers alike to demand better. If we don't, the doctor shortage will only worsen, and healthcare will remain out of reach for millions of Americans. Thanks for watching. And for all you guys who are new here to the channel, thanks for joining. Welcome aboard. Be sure to like, comment, and subscribe if you enjoy this content. I'll see you guys in the next one. Stay dynamic. Peace.